My name is Kripa Dahal, and I am a third-year medical student who will be presenting the case study titled Erythema Nodosum in a Pediatric Patient with Friedreich Ataxia. So to introduce Friedreich Ataxia, it is a rare autosomal recessive disorder involving expansion of the GAA codon within the frataxin gene on chromosome 9. According to the National Institute of Neurological Disorders and Stroke, Friedreich ataxia affects about 1 in 50,000 people in the United States and can be inherited by male and female children. Symptoms which appear after puberty include ataxic gait, speech problems, scoliosis, neurological deficits, diabetic disease, and heart disease. The symptoms progress slowly, and cardiac complications comprise about 60% of death in individuals with Friedreich ataxia. There is no cure to this disease, and current treatments aim to reduce the severity of symptoms in individuals with Friedreich ataxia. Here we present the case of a pediatric male with Friedreich ataxia that developed erythema nodosum as a side effect of a novel Friedreich ataxia drug, vatiquinone. A 10-year-old male with a history of Friedreich ataxia and hypertrophic cardiomegaly presented to our clinic with 3 weeks of multiple, non-painful, non-pruritic, flesh-colored lesions on his bilateral knees, which transformed into bruises on his bilateral shins 2 days prior to arrival. The shin lesions were painful, hard, erythematous, and locally pruritic, for which he was given over-the-counter cream and levocetirizine with no improvement. He was enrolled in a double-blind randomized study 2 weeks prior to seeing us for a medication named vatiquinone. He takes this medication 3 times a day for his Friedreich ataxia. He also takes atenolol 50 milligrams twice a day and has a surgical history of circumcision. His vitals were within normal limits in clinic. On physical exam, he had bilateral bruisings on the pretibial area of the lower legs, a maculopapular rash on both arms, scarred lesions on the bilateral knees, and ulcerative lesions in the buccal mucosa. These images are seen under the clinical imaging section of the poster. He was then referred to pediatric dermatology for further workup and management. So this case illustrates one of the side effects of the novel experimental medication, vatiquinone, on a patient with Friedreich ataxia. The patient described in the case report was officially diagnosed by the pediatric dermatologist with erythema nodosum, likely secondary to vatiquinone use. Vatiquinone is a part of the drug class parabenzoquinone. It works by targeting 15-lipoxygenase in order to control inflammation and oxidative stress, 2 parameters that affect disease progression in Friedreich ataxia patients. According to the National Library of Medicine, this class of drug can cause localized contact dermatitis, pruritus, dry skin, burning, desquamation, erythema, and hypersensitivity reactions when used therapeutically. As stated in the introduction, there is no cure for Friedreich ataxia, and this case study aims to raise awareness for individuals with Friedreich ataxia that are currently on or will be prescribed vatiquinone. Understanding the possible side effects of medications can aid patients in differentiating between symptoms related to their disease versus symptoms related to the medications they're taking. Knowing the side effects may increase medication compliance as well as give patients autonomy in picking their medication regimens. Furthermore, Friedreich ataxia is a rare disease with no cure, and medication regimens that aim to relieve symptoms can be quite extensive. Vatiquinone is novel in the sense that it is a single medication which has shown a significant effect on disease severity and progression at 24 months in other trials. This concludes my poster presentation titled Erythema Nodosum in a Pediatric Patient with Friedreich Ataxia. Thank you very much for your time.